It is absolutely true that if all we're doing is adding more people to a broken system, then costs will continue to skyrocket, and eventually somebody's going to be bankrupt, whether it's the federal government, state governments, businesses, or individual families. So we have to deal with costs, and I haven't heard anybody disagree with that. Now, I've already indicated some statistics, but I just want to reemphasize these. More than a quarter of small businesses have reported a premium increase of 20% or more just last year. 20%. As a consequence, a lot of small businesses have dropped coverage altogether. Fewer than half of businesses with fewer than 10 workers now offer coverage. By one estimate, without health care reform, by the end of the decade, premiums for businesses would more than double in most states, and the total cost per employee is expected to rise to more than $28,000. So you can imagine what that does to hiring, what that means for incomes, and you can imagine how many families are going to be unable to afford insurance. As I mentioned earlier, I hear stories from people all the time about how these costs have very concrete impacts on their lives. I spoke to a family, the Links from Nashville, Tennessee. They've always tried to do right by their workers with their family-run company, but they had to do the unthinkable and lay off employees because their health care costs were too high. I've talked to other business people who say, we were going to hire, but we decided not to when we got our monthly premiums. And so one of the goals that I set out very early on in this process was, how do we control costs? Now, what we have done, as I mentioned earlier, was to try to take an idea that is not just a Democratic idea, but actually is a Republican idea, which is to set up exchanges. These are pools where people can come in and get the same purchasing power as members of Congress do as part of the federal employees' health care plan, as people who are lucky enough to work with big businesses can do, because there are a lot of employees in those big businesses. What we've said is that if you join one of these exchanges, you will have choice and you'll have competition. You will have a menu of private insurance options that you'll be able to purchase, but because you're not purchasing it on your own, you're purchasing it as part of a big group, you're going to be able to get lower costs. For folks who, even with those lower costs, still can't afford coverage, we provide some subsidies. But here's what I want to emphasize is that even without the subsidies, it's estimated by the Congressional Budget Office that the plan we put forward would lower the costs in the individual market for the average person who's just trying to buy health insurance and they're not lucky enough to work for a big company, would lower their costs by between 14 and 20%. So, Lamar, when you mentioned earlier that you said premiums go up, that's just not the case according to the Congressional Budget Office.
Mr. President, if you're going to contradict me, I ought to have a chance to. The Congressional Budget Office report says that premiums will rise in the individual market as a result of the Senate bill.
No. Let me, and this is an example of where we've got to get our facts straight.
That's my point.
Well, exactly. So let me respond to what you just said, Lamar, because it's not factually accurate. Here's what the Congressional Budget Office says. The costs for families for the same type of coverage as they're currently receiving would go down 14 to 20%. What the Congressional Budget Office says is that because now they've got a better deal, because policies are cheaper, they may choose to buy better coverage than they have right now. And that might be 10 to 13% more expensive than the bad insurance that they had previously. But they didn't say that the actual premiums would be going up. What they said was they'd be going down by 14 to 20%. And I promise you, I've gone through this very carefully with the Congressional Budget Office. And I'll be happy to present this to the press and whoever's listening, because this is an important issue.
Well, may I?
Let me just finish, Lamar. Now, what we've done is we've tried to take every single cost containment idea that's out there. Every proposal that healthcare economists say will reduce healthcare costs, we've tried to adopt in the various proposals. There are some additional ideas that Republicans have presented that we think are interesting, and we also tried to include. So let me give you an example. You mentioned the idea of buying across state lines insurance. That's something that I've put in my proposal that's actually in the Senate proposal. I think that it shows some promise. You mentioned that, that Mike Enzi has previously said that he's interested in small businesses being able to pool in the equivalent of some sort of exchange. So that's where there's some overlap. But I just think it's very important to understand that what we've done is to try to take every single cost containment idea that's out there and try to adopt it in this bill. What I'd like to do is to see if we can proceed and have a very concrete conversation about what are the ideas that you guys have that you don't think are in our bill to contain costs. And what I want to do is to see if maybe we can adopt some of those or refine what we've already done in order to further reduce costs.
Mr. President, I've had
and what I'd like to do also is to make sure that you maybe suggest some of the ideas that are currently in the bill that you think are good. Because, Lamar, in your opening introduction, what I saw was, sort of the usual critique of why you thought it was bad. But as I said, we've adopted a lot of the ideas that we've heard from your side of the aisle. So I hope maybe you could say, well, those are the ones that we think are good ideas. Here are the things that we think are bad ideas, as opposed to just painting in broad brush. Go ahead.
Mr. President, let me show some respect for my colleagues here. They're all here, eager to speak, all sure they could do a better job than I could on any of these points. And what I would like to do is get back directly to you with why I believe, with respect, you're wrong about the bill. Your bill would increase premiums, I believe. You say it wouldn't. So rather than argue with you in public about it, I'd like to put my facts down, give them to you. Maybe other colleagues will say that. As far as Mike Enzi's proposal, he's ready to talk about it. Others are. So I appreciate the opportunity that Mitch and John gave me to talk. You've made some interesting points, and why not let other members of Congress have a chance to talk?
I think it's a great idea. I'd like to get this issue settled about whether premiums are reduced before we leave today, because I'm pretty certain I'm not wrong. And, you give us the information, and we're going to be here all afternoon. I promise you we'll get this settled before the day's out. All right? Mitch, who would you like to talk about costs?
Mr. President, since some liberties have been taken here, let me just make a quick observation. Then I'm going to call on Dr. Coburn to make our framing statement on the issue of cost containment. Well, one thing I think we need to be acutely aware of, ladies and gentlemen, we are here representing the American people. And Harry mentioned several polls. I think it is not irrelevant that the American people, if you average out all of the polls, are opposed to this bill by 55 to 37. And we know from a USA Today Gallup poll out this morning, they're opposed to using the reconciliation device, the short circuit approach that Lamar referred to that would end up with only bipartisan opposition, by 52 to 39. Now, I'd like to call on Dr. Tom Coburn, who's been a practicing physician for many years, to address the cost containment issue.
Thank you. Well, Mr. President, thanks for having us do this. I think today's going to be enlightening. The first thing I would do is put out a caution to us because what I see the Congress doing and what I saw this last year is us actually performing bad medicine. And that is that we get stuck in the idea of treating the symptom rather than treating the disease. And whether you go to Harvard or whether you go to Thomson Reuters, there's some facts we know about healthcare in America. And the facts we know is 1 out of every $3 that gets spent doesn't help anybody get well, and doesn't prevent anybody from getting sick. The second thing we know is from the Congressional Research Service that most of the mal-drivers today in healthcare come from government rules and regulations. Well, the government now directs over 60% of the healthcare in this country. And if throwing money at it and creating new government programs could solve it, we wouldn't be sitting here today because we've done all that, it hadn't worked. So what I thought we ought to do is maybe talk about why does it cost so much? Because the thing that keeps people from getting access to care in our country is cost. You mentioned Malia and Sasha. The fact is with young kids going to the ER, whether they have meningitis or asthma, they're going to get treated in this country. But they may get labeled with a pre-existing illness after that. And that's another thing I'd be happy to talk about at a later time. Mm-hmm. But the fact is we know how to treat acute asthma. What we don't do a good job of is preventing children from getting acute asthma. We don't do the good job of prevention. Mm-hmm. So when you break down the costs, what we know is 33% of the costs in healthcare shouldn't be there. Mm-hmm. And how do we go about doing that? And what are the components of that cost? And when you look at when it's studied, and if you look at what Malcolm Sparrow from Harvard says, he says 20% of the cost of federal government health care is fraud. That's his number. If you look at Thomson Reuters, when they look at all of this, they say at least 15% of government-run health care is fraud. Well, when you look at the total amount of health care that's government-run, you're talking $150 billion a year. So tomorrow, if we got together and fixed fraud, we could cut health care 7.5% tomorrow for people in this country. So what we ought to do is do the Willie Sutton thing. We ought to go for where the money is. What's the other area? What we do know, and I'm guilty of this, Dr. Barrasso's guilty of it, Dr. Bustiani's guilty of it, is a large portion of the tests we order every day aren't for patients. They're for doctors. And the reason they're there is because we are risk averse to the tort system and extortion system that's out there today in healthcare. And there are a lot of ways to fix that. But I just went through last night. If you add up what Thomson Reuters, which looked at all the studies that have been done and combined them in, they say between $625 billion and $850 billion a year of healthcare dollars are wasted. So it seems to me if cost is the number one thing that's keeping people from getting care, then the efforts of us as we go after cost ought to be to go to those areas where the cost is wasted. And there's a philosophical difference in how we do that. One wants more government-centered approach to that. I would personally prefer a more patient-centered, market-oriented approach to that. But nevertheless, there's where we can come together, just on those two areas where we could cut costs 15% tomorrow. And that's for everybody in the country. What would happen to access in this country if tomorrow everybody's health care costs went down 15%? Access would markedly increase. So what I would hope we would do is that we would go back and concentrate on the areas that have the biggest pot of gold for us. And the biggest pot of gold is we don't incentivize prevention. We don't pay rewards for great management of chronic disease. We have a system throughout the country where we're encouraging lawsuits that aren't productive for the country, and what they actually do is cause the cost of health care to go through the roof. We also know there's some other real things that we ought to address. There are conflicts of interest within the medical field. There's nothing wrong with addressing those and taking those off. We know that we absolutely do not incentivize prevention. And I'm not talking about creating walking paths. I'm talking about paying people who actually do a good job to do prevention. Talking about changing the school lunch programs where it meets the nutritional needs of Americans. Changing the food stamp program where it incentivizes people to eat the right things, not the wrong things. We actually create more diabetes through the food stamp program and the school lunch program than probably any other thing, because we're not offering and incentivizing a great response. So I think I think it's great that we're coming together, but the gold is in where's the cost excesses. And what I would hope we would do is we would look at that and say, how do we come together and actually achieve a reduction in the extortion that goes on in this country in terms of medical malpractice? And there's lots of ways to do that without us mandating to the states. I know some of you have some of that in this new thoughts in terms of incentivizing states to do that. How do we do that in terms of creating an elimination of fraud? You know, when you compare the private sector fraud rates, it's 1% compared to Medicare and Medicaid. You know, there's estimates that there's $15 billion worth of fraud in Medicaid a year in New York City alone. So we haven't attacked that. We haven't gone where the money is. And my hope would be that we would look at where the money is. And if truly it's accurate, and I don't know many people that will disagree that $1 in $3 doesn't help somebody get well and doesn't prevent them, then we ought to be going for that $1 in $3. And we ought to do it not by creating a whole bunch of new government programs, but by creating an incentive to reward people. You, in your new bill, you have good fraud programs, but you lack the biggest thing to do. The biggest thing on fraud is to have undercover patients so that people know we're checking on whether or not this is a legitimate bill. And you don't know who's an undercover patient and who's not. And all of a sudden, you start changing your attitude of whether or not you're going to milk Medicare or you're going to milk Medicaid. So,
Mr. President, if I could just say that I'm not an expert on much, but I am filibusters, and we have 40 members of Congress here.
Tom, you made some powerful points. You want to just wrap up real quick?
No, I'll just finish with that. Is with $1 out of $3 not helping everybody, we ought to go for where it is.
Well, Tom, I appreciate what you said. I think we're going to have Steny Hoyer go next. I just want to make this quick point. Every good idea that we've heard about reducing fraud and abuse in the Medicare and Medicaid system, we've adopted in our legislation. So that's an example of where we agree. We want to eliminate fraud and abuse within the government systems. Let's recognize, though, that those savings in the government systems, which will help taxpayers and allow us to do more, doesn't account for the rising costs in the private marketplace. Now, the private marketplace, you mentioned the issue of medical malpractice and frivolous lawsuits, and as you indicated, these are areas where Secretary Sebelius has already begun to try to give states some incentives to do that. On the prevention side, there's a whole host of provisions inside the legislation that's been passed by the House and the Senate, and I think Steny will talk about it. So we've identified some areas we agree on, and then the question just is, does that help the average family in the individual market who potentially can get costs? But Steny, why don't you?
Let me just respond one thing. You get cost shifted every penny that gets wasted in Medicare, and that gets cost shifted to the private sector. So if in fact we're wasting it in the public sector, we're shifting it to the private sector.
You and I agree on this. Steny?
Mr. President, thank you very much. A quote I will use is, we should have available and affordable health care to every American citizen, to every family. I suppose there are a whole lot of every Americans and American families listening to us today and watching us. And they're hoping that we're all sitting around here talking about them, not about us. That's the message they're sending to all of us. And they're absolutely correct. And we believe that we have been addressing them and trying to get some of these stories that all of us hear to a place where they won't be so tragic for individuals and for families. Every one of us has a story. I had a message on my telephone answering machine just a little while ago, a couple of weeks ago. A woman that I know well called me up. She said, Steny, I was just diagnosed with a tumor, and I've got to be operated on. I don't have any insurance. My husband makes $28,000. I work part-time and make about $5,000. She says, we're making too much money for Medicaid. And we're going to go to the University of Maryland Hospital. They want 50% down of a $25,000 bill. She doesn't have that. And we're working on that, trying to get her some additional help. Hopefully we can. I had a small business in my district, like all of you, who last year paid $1,100. Couple, healthy, paid $1,100. Their bill is going to go up to $1,830 next year. That's a 67% increase. They called me up and said, we don't know that we can afford to keep our small business going. So all of us, John McCain, my good friend, that was your quote, as you probably recall, in the debate that you had with President Obama. And the good thing was that both of you, in effect, said the same thing, that we need to get to the objective of covering all Americans and having them have access to affordable health care. We agree with that. I think probably everyone around this table agrees to it. So what we're going to talk about is the how. Cost containment is clearly one of those issues that we need to deal with. Cost containment for that small business that is having a 67% increase. Cost containment for that woman who can't afford insurance but has a health care issue that she can't avoid. It's not optional for her. So we have to deal with that. Many in my caucus believe that one way of doing that is to increase competition, to have an open, free market that is transparent. I think all of us around this table agree that a free market does that, an open market, a transparent market where people can compare prices and compare what they're going to get. And that's what we've tried to do in both these bills. Did a little differently, but that's what we tried to do. We hope we can get agreement on doing that. An open, transparent market will bring down costs, we believe. And in addition to that, Senator Coburn, we certainly agree with you that $1 in $3 is not being spent as effectively as it should be. And we have a lot of provisions in both bills, as you well know, that try to get us to a place where administrative costs, health information technology, so many other things are done to wring the costs out. And in addition, you speak eloquently and correctly about wringing fraud, waste, and abuse out of this system. I know you're happy to have seen in our bill, in the House bill and in the Senate bill, very substantial investment in doing just what you suggest. So I think we have agreement on conflict of interest in delivery of medicine as well. We've dealt with that in our bill. We've dealt with it previously, as you well know. We've put incentives for prevention in here, which you mentioned. We absolutely agree on that. We think this bill does that. Now, you may have a better way of doing it. We need to talk about how that better way is, but we certainly have addressed the issue of making sure that we have wellness as a focus, not sickness. We have to deal with sickness, but what we really want is wellness. So we've worked very hard on that in this bill. You mentioned the school lunch and food stamp programs. I'm sure we can get there too, in agreement. We certainly agree with the premise you stated. We'll figure out the way and means to get there. What have we done? We've stopped premium discrimination. That clearly ups cost. If you're in a small market, as the President pointed out, you're going to pay a higher price. We don't do that. Why? Because we're in a big market. We have a competitive edge, and the insurance company doesn't have pre-existing conditions for us. They just take us as a group. That's what we're trying to get for every American, that they have access to a large group, whether they're an individual, this woman who has the tumor, or whether they're a small business, they can get into a large group. We're trying to do that. We want to go after fraud, waste, and abuse. I'll reiterate that. Transparent market, stop premium discrimination, and make sure that people with a pre-existing condition, as none of us have a problem with, but a lot of people do have, because we're in a big group, that are in a large group, and we prohibit that. You agree with that rhetorically. Now, it's not in your legislation, but you certainly agree with capping out-of-pocket expenses on an annual basis or lifetime basis, that you don't think that's right, that people ought to continue to be covered. We believe there needs to be better coordination of care. You're a doctor. You have a number of doctors in the room. We believe that there ought to be a way that we can incentivize the coordination of care. We also believe that there should be incentives to provide care based upon best practices, not based upon simply procedures being reimbursed. I think we all agree on that. You're shaking your head in agreement, and I know we all agree on that. And you're right, we have to get there. But I would suggest to you that one of the things that many in my caucus felt very strongly about in terms of competition was having a public option. Now, there was real disagreement on that issue, but many in my caucus thought that would open up competition, would provide for access for every citizen if they didn't have access in some other way. Now, Senator Baucus is going to speak at more specifically in terms of our cost containment, but donut hole certainly is one of the issues that we need to deal with. Donut hole we deal with in our legislation in the House. We would hope that it is in legislation that we agree upon, because seniors are confronted with extraordinary out-of-pocket costs for a very significant portion of the cost of their prescription drugs. And seniors are concerned about that. We take care of that in our bill. But I think what the American public that's listening and watching expects us to do, Mr. President, is what you're doing, bringing us together, coming to agreement to make sure that we get to a place where we reach the objective that President Obama and candidate McCain expressed as the objective on behalf of the American people. Thank you, Mr. President.
Mr. President. Mr. President.
Mr. President. You know, before you go, Max, I just want to ask whether it's you, Tom, or anybody else on the Republican side, and maybe some of the House members might be interested. You know, Senator Coburn mentioned some cost containment issues where it sounds like we agree. Fraud and abuse, we agree. It sounds like you have maybe one other idea that you don't think is in our proposal, but the idea of undercover patients, but that's something that I'd be very interested in exploring. I don't think conceptually that would be a problem. The issue of prevention, and that includes, by the way, things like how our kids are eating and getting exercise, and I'm proud of the First Lady for working to see what she can do on that front. And there are some provisions in the legislation that's already been passed through the Senate and the House that directly relate to this that I think you'd be supportive of. The issue of defensive medicine, as I indicated, Secretary Sebelius is working on this, but I think that there are things that we could do at the state level to help foster innovation and eliminate some of the concerns that you've got. I would be interested in hearing from any of our Republican colleagues what objections they have to what we consider one of the biggest ways of driving down costs, and that's what Steny just referred to, which is allowing individuals and small businesses who are currently trapped in a very expensive market. Essentially, they're having to be out there fending for themselves, to be able to buy into essentially a large group, to become part of a large group, just like all of us as government employees are part of a large group, so that they have more negotiating power with the insurance companies, which I think we all agree would drive down costs. You know, if you've got some bigger purchasing power, insurance companies want more customers, they would drive down those costs. I know some of you have agreed to this as a concept in the past, and so my question is there something in terms of the way the House and Senate bills have been structured that leads you to be concerned or want to not move forward on that approach? John?
Well, Mr. President, I'd like to yield to Mr. Klein from Minnesota, who will talk about the small business health plans in terms of how we would propose to do this.
Thank you, Leader. Thank you, Mr. President. I think that Senator Alexander framed our overall position very well when he said that we're looking at thousands of pages of legislation, and we believe a better approach is to go step by step to address these issues of cost. We certainly agree that you get better economies of scale if you can come together. We have proposed in both the House and the Senate, in fact, for a number of years, that small businesses be able to band together in small business health plans or association health plans. We all know, and I've heard everybody say here, that small businesses are the engine that drives our economy. We also know that about half of the uninsured either work for small businesses or depend upon somebody who does. And so we believe that we ought to address that issue by allowing these small businesses to band together in the same way that I think, Mr. President, you mentioned, large companies do. And I mean really the same way, so that they get all the advantages of, if they self-insure, being able to avoid the 50 state mandates, being able to lower their administrative costs because they're not having to deal with that. And it will lower the cost of premiums for these small businesses and allow them to insure more people and to keep people, they're already insured, on the books, because we all know stories like we've heard here of small businesses that are saying, I can no longer provide insurance for my employees. Yeah. Small businesses have been asking for this for years. It's not a new idea.
Right.
They've been asking for it for years, and we think it's a far better way to get these economies of scale than the exchange thing that's in the huge bill. This will actually allow businesses to be able to lower their costs exactly the same way that large businesses do.
Okay. Max is going to go, and then I'll go to you, Rob. Max, do you want to address this issue of how we can allow people to buy into large groups, how the Senate bill accomplishes it, and I don't know if you want to remark on what John just said.
Yeah, well, absolutely. I'd go first like to say something that just strikes me just in spades. Frankly, we all studied this issue a lot, healthcare reform. We basically know what the problems are, all of us. We basically know the need, the current system is unsustainable. We are actually quite close. There's not a lot of difference. Close in the sense, without being corny and dramatic about this, that the American people want us to do something that's just basically reasonable. Doesn't have to be one congressman, one senator's provision, but basically reasonable. We are on the verge, on the cusp, with not too much effort to try to bridge a lot of gaps here, because the gaps, in my judgment, are not that great. Let's take the list, for example, that Lamar mentioned. As you said, Mr. President, we are basically including most of those provisions, if not all, in our joint legislation. Sell insurance across state lines, for example. We allow for that, not exactly in the way that some would, but sure, with compacts, and once state exchanges are up, people will be able to buy and sell insurance across state lines and achieve that competition. In addition, you mentioned lawsuits. Secretary Sebelius is working to try and find ways to encourage states to settle, resolve issues before they become big, bad lawsuits. Add to that, Lamar says we should find ways for states to be able to lower their costs, so we do that. We let states opt out. They can do what they want to do, and Senator Wyden also has a proposal. Senator Cantwell has a proposal. We give a lot of flexibility in that regard. Expand HSAs, that's fine. There's nothing wrong with HSAs, but we also have to have products for poorer people, lower income people. HSAs work pretty well if you have middle or high income. Pre-existing conditions, clearly, we all agree on that. We have those provisions in our bill. Respect to small business, we're not that far apart. Some suggest association health plans, where small business people can band together in an association pool and get better insurance. That's fine. What we provide for in our legislation is something similar. It's called the SHOP Act. Various senators, bipartisan, have worked on this. And basically, it allows sets up a small business arrangement in exchanges. Small business participates in their own exchange and gets the advantage of all the pooling. And then they can do what fellow employees do today. They can shop and compare and to get the best deal. And I would guess that most small businessmen would like to do that. I might add that we're also providing tax incentives, tax credits for businesses, small business, that wants to purchase health insurance for its employees. And it's pretty good. It's 35% tax credit the first couple of years. Then once the exchange is up, it's 50%. So The main point is we're not really that far apart. We're trying to find ways for small business to pool, small business to take advantage of competition, to shop and compare. Also some tax provisions that to encourage businesses to get health insurance. And I might say, too, that if you look at all the provisions that Stanley outlined, many of them, we agree. We agree on prevention. There are major prevention provisions in our legislation, as Senator Coburn mentioned. We also agree on trying to change the way we reimburse docs. I think the biggest game changer here, frankly, is how we reimburse our doctors. They're based more on quality rather than quantity. I know Tom Coburn really agrees with that as a doctor. Most doctors do. And it's another example we really are close. And I think that once we keep pushing on those areas that we're close, it's going to make a difference. The exchanges, as you mentioned, Mr. President, it's a Republican idea. It works. What I like about exchange, it's like Orbitz. It's like Expedia. You know, you go to Orbitz or Expedia to buy an airline ticket. You compare it, get the best price. That's basically what this is. It's an exchange. You go to the exchange, you shop around, and you get your best price. That's going to help, in my judgment. I also think that we should, where the hospitals should publish the cost of their basic procedures, whether it's appendectomy or colonoscopy or whatnot, to enable consumers to shop around. Where's the best price? We all know that there's a wide disparity in what hospitals charge for the same procedures. I think disinfectant of sunshine helps. It helps the consumers. It helps our people. And fraud and waste, we've talked about that. We have major provisions in our bill to fraud and waste. Mr. President, I compliment you because in your proposal, you go even farther.
We took some additional ideas from folks like Congressman Ross.
They're great ideas. And we address the unnecessary readmission rates, from hospitals, et cetera. The main point is we basically agree. There's not a lot of difference here. And I just like us to kind of just, there's an opportunity for us to work out some of these differences.
Mitch, is there somebody?
Yeah, Mr. President, I'm going to yield to John here.
John?
I'd like to yield to Dave Camp to continue this conversation about cost containment.
Dave?
Thank you, Leader Boehner. Thank you, Leader Boehner, and thank you, Mr. President, for the invitation today. I think as we focus this part of the conversation on cost, a lot of Americans say to me, if you're really interested in controlling costs, well, maybe you shouldn't be spending $1 trillion on health care, as the Senate and House bills do. Also, cutting Medicare benefits by $500 billion to fund this new entitlement is, I think, a step in the wrong direction, and many Americans do as well. The nonpartisan actuaries at the Center for Medicare and Medicaid Services say on page 4 of their letter on the Senate-passed bill that it would bend the cost curve in the wrong direction by about $250 billion. They specifically say the health expenditures under the Senate bill would increase by $222 billion. A key way of reducing costs that's missing from the House and Senate bills is responsible lawsuit reform that guarantees injured parties, much like our two largest states have adopted, Texas and California, access to all economic damages, such as future medical care. If they need nursing care in the future, they'll get it. Lost wages, reasonable awards for punitive damages and pain and suffering. On page 4 of its letter to Senator Hatch, CBO found that this common sense reform would reduce the federal deficit by more than $50 billion. Now that's just on the government side, because as we know, CBO doesn't score the private side on this. And PricewaterhouseCoopers has done a study that said savings could be as high as $239 billion if this reform were adopted. There are two features in the House and Senate bills that move in the wrong direction. Both bills feature restrictions on health spending accounts where people can save tax-free for their health care, as well as FSAs, flexible spending accounts. These changes are such as they ban the use of over-the-counter medication out of both of these plans. There's a new cap on FSA contributions of $2,500. That text, that language is found on page 1,959 of the Senate bill, and that will hinder the growth of those plans, and which encourage Americans to consider quality and price when they purchase health care. And let me just say, under HSA plans, Premiums increased just 1.3% for individuals in 2007 to 2008 and declined 5.4% for families in that same period. And when people switch from a PPO, a preferred provider organization, to a health savings account, their premiums declined by an average of $3,800. Now, another concern I have is the Senate bill, which on page 982 creates an unelected board charged with recommending even more Medicare reductions. And if Congress doesn't accept these recommendations, they have to find other Medicare spending to cut instead. And that gives, I think, too much authority to unelected bureaucrats rather than to elected representatives of the people, and the power to decide whether to cut Medicare and by how much. Now, holding down health care costs for the government is important, but I think it's also important to hold down costs for families and employees.
Dave, I don't mean to interrupt, but we're going to have the whole section talking about deficits, and we can talk about the changes in Medicare. We were trying to focus on costs related to lowering families. And, the only concern I've got is, look, if every speaker, at least on one side, is going through every provision and saying what they don't like, it's going to be hard for us to see if we can arrive at some agreements on things that we all agree on. So I don't want to try to cut you off. Please finish up, but I just want to kind of point out that
I do want to say on this issue on premiums, CBO in their letter on page 4 does say that the estimated average premium per person for non-group policies would increase by 10 to 13%.
This is the discussion that I just had about Lamar.
Yes,
and
they do say that, and they do say that the value of the benefit is higher, and that is why it goes up. But the reason the value of the benefit is higher is because of the mandates contained in the legislation. And this is one of our big concerns with a lot of the issues that have been raised. Yes, we have similarities, but when all of this is structured around a government-centered exchange that sets the standard for these policies, states can't get out of these requirements unless they seek a waiver from the Secretary. That kind of approach raises costs. And so both of your comments were correct that costs do go up, and it's because they have a richer benefit. But the reason it's richer is because of the mandates contained in these very large bills.
Okay, I'm going to let Rob, feel free to respond to anything that Dave indicated or to any of the other issues that have been